Hey guys, welcome to the show. This week I've got a very special guest, Dr. George Dockendorf from Aqua Vitae IV Bar, and he's a medical doctor and a retired vet from the area. So you're going to enjoy today. He's got a very cool vibe going on. His Aqua IV Bar is in Miramar Beach, and you'll hear a lot about that today. But George, welcome to the show.
Thank you for having me, Chuck. I've been looking forward to this.
Good. And I also forgot he is AKA Dr. Drip, correct, on the radio commercials running around town here, huh?
That's right, Dr. Drip of the Y.
So you come up with that because of the IV bar, or how did the name come about? I've never heard this story
Yeah.
yet.
Well, with branding comes a character eventually, and that's how Dr. Drip came around. So Dr. Dockendorf is my real last name. That's hard to say because usually people will say a cuss word accidentally when they try to say that three times real fast. So, and then it became Dr. D, and then Dr. Drip just made sense. And why did we use a Y? Because Dr. Drip with an I was taken.
Oh, gotcha. Okay.
Yeah. But the Y, we make it look like a martini glass, so it makes sense.
That's cute. It goes right in line with the branding that you got going on at your Aqua.
Yeah. Aqua Vitae. Some people
Website.
say, yeah, most people say Vita, and I say that's what I'm wearing right now is
Yeah.
Aqua Vita.
Yeah, I think I said it as Vitae, right? Is that correct?
Yeah. Yeah. Aqua
Okay,
Vitae. That's fine. Yeah, you did good.
excellent. So you've been doing that now for a little over 3 years, correct, down there?
Yeah. 3 years. We had our 3 year anniversary about a week ago, and I'm just blessed that we made it that far. It's been a little bit. 3 years, being a business owner, whenever you start something, you don't know if it's going to take or not. And after we found what the niche was, it became quite successful. And we're the number one, without a doubt, the number one IV drip bar. You look at our ratings, and our competitors don't like us, so that's fine because that's the best compliment you can have.
That is. That's definitely the best compliment you have, and especially now, congratulations on the 3 year mark. But the hardest year is your first year, and you've made it through there, and now rounding the corner and hoping for the next 5 to 10 year marks to celebrate coming up. Right?
I hope so. Yeah, we don't have to look at the price of corn anymore. So now we can just, that's a
Good.
joke that my wife's going to love.
That's excellent. Yep. Bring Stacy into the mix
Yeah,
of today's
of
conversation.
course.
So, and she's at the IV bar today.
She is.
For work.
She is.
Yeah. So
She
if you ever
is.
want to stop by and swing by and see Stacy, she's a happy, smiling face at the front desk that'll take care of you.
Yes, she will. She's much different than me. And, she makes a lot more sense. But she's the yin to my yang.
That's right. So speaking of the branding part here, your cool look today. When I first met you, it's been what, 2 years now? I think we've known each other.
Yeah. Yeah.
Um, how did you come up? Has this always been your style or your trend, or did you just start going into the branding in the past couple of years?
So it was my off-duty look, I guess I'll call it. As you already know, or well, maybe your viewers don't, but I'm a full-time ER doc as well. COVID is kind of what led to this. It was just a weird year, if you remember. I think a lot of people lost their individuality, and I just started wanting to, be what I felt like I wanted to be, and it resonated. And in fact, it was so well received by actual patients in the emergency department because I don't look like a traditional emergency medicine doc. And I noticed that because of that, they let their guard down. And it just seemed like there was a lot better rapport. And my bedside manner also improved. Just when you walk in, if you look like a janitor, they tend to like you a lot better.
Right. And it goes with your high energy vibe. I mean, you've always had high energy
Yeah.
around, so it definitely fits in with the style that you've got going on.
Yeah. No, I like it. I wanted to be a pirate at one time, so that's where this came from.
Hey, hey, you can still work on that, right? We live down here on the beach, over by the cove. You'll be good.
I'm missing everything but the boat.
So working in the ER down here, how long have you been in the Panhandle area for? I forgot now, but how long have you lived down this area for?
A little over 5 years. But we
Okay.
moved. We moved here, of course, again during COVID. I was ER doc I was the ER doc in Vegas for 5 years, and then we moved to Albuquerque, New Mexico. Once I was there for almost 2 years, and then COVID hit, and as you know, some states are very, very, very left, and that state just shut down. And with my personality, I couldn't handle it. So I told my wife, I said, "Hey, if I get a job in Florida, would you be willing to move?" And she said, "Yeah," and she didn't think that that was going to happen, and it happened in a week. And here we are, 5 years ago. Yeah. So I signed on for a 2 year contract out at out at well, I don't even know if I can say, but I'll say it, Fort Walton. I'm not saying anything negative. Fort Walton
Yeah.
Medical Center, and I fulfilled that. And then, I've been an ER doc for a long time. Well, I'm sure we'll talk about that, but it was an ER doc in the military. I did my time, and it was a point in my life that I just said, I want to try something a little bit different. And it just seemed like the right thing to do with my personality. Yeah, and it did. It turned out to be the right things. After I fulfilled that contract, I started and I opened the IV bar. I did not rely on the ER as a backup. And there's nothing that'll make you better than when your family's mouths depend on your business. It makes you get good at what you're doing. And then as it got to where it's done so well now, it kind of runs itself. And I work in the ER in addition to running the business.
Yeah. Yeah. No, excellent. I mean, that's definitely the right motto to go after. I've started multiple business in my lifespan, and my wife would say the same thing. If you go in it half-hearted, or if you put one foot in, one foot out, it won't be successful.
Absolutely.
You've got to go 100% in it. There's no plan B. And
Yes.
that's why you're in year three right now, and it's growing.
Yeah, and as you probably know, it's a test of marriage when because you have to have a lot of people believe in you. They believe in your mission,
Yep.
and some people might think you're crazy about what you're thinking. And if they stick with it long enough, either A, they're right, or B, you're right.
Right.
And luckily I was right, so I'm still married.
Yeah, that is good. It is definitely a test and a stress on marriage, life, and in
Yeah,
general, starting any kind of business.
yeah, absolutely.
So being in the area and that we're Panhandle focused here on my show is, do you think it's any more difficult to open an Ivy bar here in the area, or do you think it was easier because of the area that we're in?
So I got into the IV bar. That's a great question, by the way. I got into the IV bar business a little bit later in the game. It's kind of a saturated market, and everybody thinks they can do it. And it's not necessarily rocket science. You do have to have certain credentials. I came into it. There were two other IV bars already here that had been well established, so I had that to compete against. So I found, being an ER doctor does help, but it wasn't enough. It wasn't enough. I had to, like we talked about, I had to create a brand. I had to create a reason why people wanted to come there. And so there are people that still are trying to open them up, and it's in their thought process, they think it's easy money. And I can tell you right now, it takes a lot of work, and it's not a benign thing. People can get hurt. So as you already know, I'm an advocate for the highest level of professionalism running those places. And the word got out that I'm honest, which I really am, and that I am educated as a physician. And that did help. But again, like I said, it wasn't enough. I had to create a reason you'd want to go there just to chill out. That was my thought process. And so now, like I said, those two people that were here well before me don't like me. I never met them. And there's a chain that opened up down the road. I mean, I welcome competition. I do. It
Yeah.
doesn't bother me. It makes me better. It makes me better. So, all I was saying is if you want to open an IV bar, be original. Don't try to copy me and make it your own. And, if you build it, they will come.
Yeah, and it goes on there with relationships. You can open up a chain of business beside you, and yours is going to be more successful because you're building those relationships and you have that different style uh, and service of care there that you provide.
Absolutely.
So being in the Destin area as well, do you think there's a better benefit because you're getting a lot of you have the mix of locals that live here year round. You have tourists that come in a lot throughout the season and the off seasons. How does that impact your business? You think it's better that we have the big rush of tourists throughout the year, or
Just like any business here, I consider us more of a service industry versus a medical facility. There's a fine line that you toe when you're in the IV bar business because it's almost off the shelf kind of thing. I want to buy an IV, right? And again, that's where that importance came, where I think a qualified physician should be there because you can hurt people. Not everybody gets approved for it. Like there is a screening process, just like if you went to a doctor's office, but I make it quick. The part about this is a very transient town, as you know. So obviously my best months are going to be during the hotter summer months when people are drinking because there's nothing better than an IV after you're hungover. It
yeah?
really does work.
Well, you even have some. What are some cool names of your IV bags for afterwards,
Oh
right? You
yeah.
even named
We got the Mag Daddy, obviously named after me. We got which is our take on the Myers, which if for the IV aficionados out there, the
yeah,
Myers was the original IV cocktail made for Hollywood stars back in the 60s. It's got a little bit of everything in it. The hangover helper, I think that's pretty clear what that is. We have immunity boost because we all know we learn, and it's funny because doctors, allopathic type physicians that follow evidence-based medicine for the longest time, we didn't really think vitamin C and zinc really did anything. And then COVID proved us a little bit wrong. It actually did abate. It doesn't get rid of the symptoms. It doesn't
Right.
prevent but it does minimize. We have the immunity boost. I call it the immunity boost. We have stuff for women in their menstrual cramps. We call it the cramps crusher. So that's always a rough time when people come in and I'm there. That was a joke.
Yeah, we got you.
So, but it's not just for menstrual cramps. It's also great for leg cramps if you just ran a marathon because it has calcium and magnesium, and that's usually why people have cramps. Is
They're all
is
around cramps.
yes, of course, the anaerobic, the acid that builds up in your muscle that causes it. But we resolve that with fluid. The calcium and magnesium replaces it, and then you feel like amazing bugs. And we got like 5 other IVs as well.
That's good. So, how did you come up with the names? Just sit around one day and just start crafting up some names and see what hit?
Yeah, again, it was I look, can you believe this? I've never been to another IV bar. I've never ever have been to another IV bar, and I did that on purpose
Yeah,
because I didn't want to copy. I didn't want to emulate people, or I wanted to be my own entity. So I, in my brain, thought, well, what what would I want as an IV bar? And
right.
as you've been there, and it looks kind of like a Las Vegas nightclub, and people like that. I don't want anything medicinal about it, and that goes along with the names of the IV cocktails. If you read our menu, it makes you laugh. The Mag Daddy, it's good about everything. That's pretty much what I put
Yeah,
in there. I wanted there to be a little bit of humor, and so the names, everybody uses the same names, and I was like, no, let's use something different. Let's make it our own. So that's how I came up with it.
no, it is great. Yeah, and we've been there. It's a tremendous experience. You go in there, you get sit in the massage chair, get your IV on there, you get oxygen put in with some flavoring in there, and you can either watch the whole wall, and it's all moon spaced or retro in there because you got big projectors on the wall. So it's a very
Yeah.
cool experience.
It's I call it the mid-century rocket age vibe. That's what
There you go.
I always been a big fan of that. I just love that era. And that's, so all you imitators that want to copy me,
Yeah, don't copy. Yeah. Don't turn into the video here and see the vibe in the background, Doctor Strange on the
yeah,
wall there, the bandana and glasses. It's all branded. It's copyrighted, right?
exactly. That's right.
Have it
Oh,
trademarked by the end of the week.
that's right. If they wanted to, they probably look like an idiot if they tried it. And that's the other great thing is when you brand yourself, if you are yourself, uh, plus 5%, right? A little exaggeration, but
Yeah.
yeah, if somebody tries to copy you, it comes across as just that. Well, by being yourself and not copying somebody else, you come across as more sincere and um, you're a little bit more clout level legitimate, and people trust you. They
Right.
realize this is who you are.
Yeah. Good. Oh, so that's great. Do you have any plans for expansions or what's on the horizon for the IV bar anytime soon, or just continue to expand where you're at for now?
So, as another great question, I have had so many people interested in wanting to franchise this out, or partner and open up another one, maybe not franchise, but just just opening up another store. And I'm not, I'm not uh, against it, but also at the same time, make the right offer and we'll talk.
Yeah. Yep. And
And the other,
do you think in the
go
area
ahead.
here, like maybe split off and come down towards Panama City area? Are you looking different state-wise or expand in the region?
Yeah, so I think we would do well wherever we go. If you've been to an IV bar, they're almost all the same. They're very med spa-ish, which is, that's fine if you like that. But if you want something different, we definitely have that. So I've had people drive down from Panama City from Margaritaville who actually run that, asking if I'll open one there. Wasn't ready to do it at that time. I was still figuring out who I was, and we're 95% there about who we are, and that's again that's another. I think it takes 2 to 3 years to figure out who you are, and so yeah, my thought process is I would be willing to do it, but a good point that somebody brought up was, and it's not toot my own horn. I am a little bit of a quirky character that people like. And the question is, how is that going to be duplicated? And
Right.
so we're working on that. We're trying to figure how to, I think we can do it without me being there. just creating the atmosphere and getting the right people that believe in the mission.
Yeah.
That's easier said than done. But it is something I'm looking into. Absolutely.
Yeah, and if it's in the Panhandle and you expand sort of the Panama City, Margaritaville area, you could do a couple of times a month over that area or something to keep the vibe and that going as well.
Absolutely. Absolutely.
Yeah. So being a change paths, change directions a little bit here, being an ER doc in the area and an ER doc across the US, what do you think makes it so difficult for our area to keep good doctors in the Panhandle?
So being that I've seen that happen across the United States now. And number one, Florida is probably one of the top litigious states. They don't have a great tort law here. Texas, you can go hurt somebody and essentially not get sued. They have the best tort law, meaning it is very, very hard to sue somebody. Here, if you look at somebody the wrong way, you can get sued, and so that makes it hard, and that makes it undesirable for because that's the first thing doctors look at is what are the malpractice rates, and Florida is one of the highest. So that's one. Number two, there's a lot of change coming with medicine, just like a lot of people are going to be losing their jobs with ChatGPT and stuff like that. The corporate, I'll call it corporate, the corporate hospital takeover of medicine. They are looking at cheaper ways to be able to provide care. And let's just say a physician's not it. Well, they go down a step. And they think that if the more algorithmic that you make medicine, if you put somebody with semi-decent knowledge and a great algorithm, then you can pay that person three times as less. And that's happening all across the state. That's nothing new. In Houston, they fired 200 and something pediatricians, a group, one of the groups did. They have to keep one MD or DO on, but now that person's supervising everybody that's not a physician. So that's a little scary. I think people are going to be in for a rude awakening soon. I personally only plan on practicing for another couple of years. It won't affect me as much, but as you know, my daughter wants to be a doctor, and I try to talk her out of it. I told her to be a lawyer, and
Yeah.
because she's dead on it, and so my I fear for my I just fear for that future. Medicine's changing, so
Right.
that's a big one. It's the tort laws, it's the litigious. It's just too easy to sue for stupid stuff here.
Yeah, yeah, I think the AI and the tech, I'm a tech guy, as you know, like is all ways to help and improve patient and medical care. But I think it's new right now and everyone's not figuring out how to do it properly. We're in that changing phase of, well, we got all this data. What do we do with this data? We can have a PA or a physician assistants do this and do the same, but they don't have the experience from the general surgeon or an ER doc to give you the same
Right.
medical advice, which
And
makes
it's
it hard.
interesting. It is. What's interesting is there was a huge movement of mid-levels gaining independent practice, and that finally stopped. I want to make it clear I'm not bashing NPs. I work with incredible NPs. We all have a place. I don't claim to be a cardiovascular surgeon.
Right.
I'm not. I'm an ER doc, so I would never even imagine going to do that. Somebody who didn't go to medical school, they might. I've met MPs who were just as smart as a doctor. I really have, but
Yeah.
they didn't go to medical school. So that if you want to do that, you have to go to medical schools. Just like being a pilot, there's people who can probably fly a 747, but would you want them to if they're not, uh, credentialed to do that? No. So it's the same thing. But MPs, this part I will put down is again, COVID created an opportunity for corporate to figure out this is our perfect opportunity to fire a lot of physicians. We'll bring in a lot of lower mid-level trained and we'll get rid of all these people. And they thought that was going to work. In the long run, we've done some studies and we found out it doesn't work. They order more studies because they don't have that level of experience. And that's costly when you're ordering a CAT scan on every single person that comes in with a runny nose because
Right.
you don't know what to do. So that has stopped. I don't know if you're aware in California, there's another back door that was attempted where there's doctors of nurse practitioners. That's a degree that was made up
Yeah.
because with one intent, they want to walk in and be able to say, "Hi, I'm Doctor So and So." That, believe it, of all states, California shot that down. So, but they're going to keep coming at it. They're going to keep trying, and I think eventually people are just going to get fatigued and go, "Okay, fine, here, you can do it." So, like I said, a lot of big changes. A lot of
Yeah.
big changes.
I mean, in healthcare, most people don't look at healthcare. It's a money business. It's a business machine, just like anything else. Just like us creating a small business, you operate it to be the financial engine of your organization, and healthcare does
Yeah,
the same. And
absolutely.
they go and try to do crunching numbers with AI and tech, which is all great, but it's relatively new in the game and not fully baked.
You're right. It's fun. You just made me think of something. So I remember when medicine was fun. It was a fun field because you were doctors are independent thinkers. We have to be. And corporate doesn't like independent thinkers. They want to be able to tell. They want factories. They want widgets. They want everything's a metric. And with medicine, it doesn't work like that. It's why it's called practicing medicine, and no two cases are the same. And you don't know what's going to come through the door. We don't make appointments in the ER, right? You just come in, and that's burning a lot of ER docs out because they're constantly, getting emails from corporate saying you're not doing it. You took too long to pick this person up, and they don't really care that you had three codes cardiac arrest going on at that time. So it's very stressful, but yeah, there's a high burnout rate too. So you do see a lot of doctors looking for that second gig where they can go be an independent thinker and
Yeah.
do their own thing.
Yeah, and that's what I mean, you brought up a good point. That's exactly right. Where you're talking about that over the weekend, that there's systems set in place for you to check boxes for them to measure, and this is based on some algorithm in the back end that is only as good as it's being programmed, but it doesn't take into the effect of what else is going on with that patient at that current time. But because the program is designed on a set of boxes and a check boxes, it has no other parameters that you can put in it to make any other decisions. It makes it hard to
Right.
fit everybody into.
I think it, I think it also, and I think it makes doctors make hasty decisions because they're worried about those times.
Yeah.
So it's dangerous. I feel it's dangerous.
Yeah, I agree. I went through 10 doctors since I've been here. Every year, my doctor has like changed from my primary care doctor just because they've either retired, they got burned out, they moved out of the area. So it's hard to keep consistency in there when your new doctor's coming in and saying, "Well, let me go over your chart from last physical and see what's changed. Can you get me up to speed on your health?" And you're like, "That was a year ago. I can't remember what I told you. Can I have access to it?" That's another issue. We don't have access to all that personal data either. So that makes it even complicated for us.
You're absolutely right. It's consultants very hard to get to come into town. And like you said, when they get here, after a couple of years, they're like, "I'm out of here." So it's all based on what we just talked about. Same exact thing. They get metrics. Well, everybody gets metrics, and it creates a little bit of a hostile environment to work in too.
Yeah,
Everybody is so you throw that all into the mix, and what do you get? You get somebody who I try to make it fun. I have to.
right.
I'd go crazy if I didn't.
Well, I mean,
So
it's a
I
great
do.
thing. The ER, you're going in there and you're like, no one wants to be in there. You're going to be sitting there
Right.
forever. You're sick. You're not feeling good. So if the doctor's coming in and is like, yep, 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 give him a flu shot or give him XYZ, send him home. It's not, I'd rather have more of your style doctors. Everyone's different. Everyone has their own cup of tea that they like, but make it more engaging and interactive with the patient. And
Absolutely.
you're going to feel better just off the bat for that as well.
No, I find if you just ask them where they're from and give them, 60 seconds to talk,
Yeah,
it makes all the difference in the world. But then I also realize my matrix numbers are going down because I'm taking too long in there. And that's the hypocrisy of it. It's funny. So we have what they call Press-Ganey scores. I don't know if you're familiar with this, where at the end of your visit, the patient will get a call or something in the mail to rate their doctor. And the biggest one is usually the doctor didn't even listen to me or talk to me.
right.
They were in there for 6, and that's again, that's not the doctor wanting to be like that. That's the doctor being driven that way. So
Right. Yeah, you made an interesting comment a second ago that I recapped on. As you said, they go into these private practices, they go out to these concierge services, which is great, but the normal Americans can't afford those. And I'm sitting there thinking because there's a couple uh, or some friends that we know as well that have this. I think it's called the VIP or MVP
I
service
know if
around here.
you
So you pay a flat fee, and you have a doctor that only sees 10 customers, but patients or individuals a year. But that fee basically covers their entire salary plus whatever you cover for the year. And that seems to be the way that's going if you want in this area a steady healthcare provider.
and I have a VIP concierge doc just because of that, and I love it. They're relaxed. they don't have somebody with a whip telling them they're not going fast enough. And yes, you're right, it does cost a little bit more, but I don't think it's out of the reach out of a lot of people, but if you still need insurance. If you have something catastrophic, they're not going to be able to help you. You still got to have a surgeon. So it's got its benefits, it's got its plus, but that's where a lot of doctors are heading, concierge.
Yeah.
You'll see that with hospitalists, emergency medicine, family practice. They're all heading that route because they can do their own thing, and customers appreciate it, or clients, patients.
Right. Yeah. Everyone raves about it. I mean, you get the individualized care that you want. That's interesting. I didn't
That's it.
realize you had one of those service providers. Even with your vet status, do you still utilize that and not the military service or the hospitals around here in the area? Because
Yeah,
that
oh
is
yeah.
one thing that's bad about the Panhandle of Florida. We literally have no VA hospitals besides a small clinic in Panama City, and Pensacola is the only way to service the vets in the area.
Yes, I utilized the VA once, and after my experience, I said, I'll just pay for out of pocket. Well, I mean, I have insurance, of course,
Right.
from retired Air Force. Uh, I'll use the VA if I need to. Right now, I just didn't have a good experience with them. I
Yeah.
think they're under the same, well, they're government, so they just take their time. That's probably the opposite of what the big corporate hospitals are. When you're government, you're almost like got tenure, and it's hard to fire a GS 15.
Yeah. And I think so. Was that is true? I've been working in the government my entire career, and there's a lot of
Yeah.
that going on, and some of that's getting corrected now, which is good. But was that bad experience that you had in this area with the VA, or was that
Yes.
somewhere else?
Yes.
Okay.
It was a doctor who he was, I think he was Swedish, and I don't know, his bedside manner was absolutely horrible. And the minute I was there, I was like, okay, this is not the way I think medicine should be. And maybe because I'm a physician, I saw things different than maybe a non-physician would see, but I felt the care, or his bedside manner was less than stellar. And I said, I'm not going to go back.
Yeah,
But
no, yeah, I agree with that. I think that was the reason for that question is my dad was a vet. He passed away a few years ago, but when we lived up in West Virginia, we had a full-on VA medical center up there, and he was getting great care because it was a hospital. It was a full staffed functioning hospital that
yeah,
could do anything and everything that he needed up there. And then when we moved down here, the service was for him being a senior as well and being a retired vet was not the par. His doctors would change over. He would have to drive all the way to Panama City, or they would try to send him to Pensacola at the time, or sometimes to Fort Walton, which definitely needs corrected in the area for the vets. And here, your dad was a
it
vet as
does.
well, so you went through that same way.
Absolutely. And and some people don't have choice. I mean, that's the only care that they're going to be. They can't afford private insurance, and luckily I can. But maybe there'll be a day I can't, and that's what I'm going to be stuck with. And I the VA has come a long way, but they still have a long way to go. They do.
Yeah,
And I've heard great things. Of course, I'm basing this off one doctor, so I realize that's probably not fair. First impressions count for me,
yeah.
and so I didn't need to go back there, and I said, let's just do private. And my experience has been better.
Right. And that we have it. And you probably did the same thing. You advocated for yourself, and we got the healthcare that you wanted. Me and my two sisters, both my sisters are nurses. So we advocated like crazy for my dad as well to get the care that he needed. And he ended up getting doctors at Sacred Heart and the heart doctor around here with I can't remember what it was called, but they give you a VA choice or some kind of card at some point in time, which is the way that we got him those benefits out of the
Yeah.
VA hospital centers.
Yeah.
That
Yeah.
was the only way you do. You have to advocate for them because if you don't advocate for yourself, you get stuck with the choice that they give you.
You're absolutely right. And some people don't have that personality to advocate for themselves. They're just very passive. And I feel bad for those people because they're like with my father, if you remember him. He was kind of getting a runaround, and I finally went with him, and I had to be his advocate. And it takes a lot out of it. You know that to have to. You don't want to be that guy. You don't want to come across. I hate it when somebody makes a point to tell me that they're a nurse. It's like, well, thanks for telling me. I'm still gonna treat you the same. But in some cases, if you really truly feel that your loved one is not getting the standard of care, then you got to pull that card out. And not a lot of people are doctors, so it's hard to do. And I let that guy know that I was a doctor, and I'd never refer anybody anyway.
Yeah. Everyone's doctors with WebMD now, right? Or ChatGPT. You can solve all of your healthcare
Oh
problems.
yeah, WebMD, goodbye. Now it's even worse.
Yeah, I've not tried that yet. I've not tried a ChatGPT a symptom. I'll have to do that just for fun one day.
Oh my gosh, I've had people pull that. Doctor, this is what ChatGPT says. And ChatGPT is got a lot of work to do. It does. It's got some benefits, but man, it is not. Again, remember we talked about it, it's practicing medicine. Disease does not read the textbook. It
Yeah,
doesn't.
right.
It doesn't. And so there's, it's that training, that gestalt and your background experience, and sometimes you'll find a red herring that does not meet the textbook. And had you not had that training, then you could potentially end up missing things. I do like Chat GPT because it certainly helps make the notes look nicer,
Yeah,
but I don't use it for my medical decision making at all.
right.
It
No,
just corrects
yeah,
my spelling.
yep. My emails look a lot more professional nowadays.
Oh yeah, they all look like lawyers wrote 'em,
Yeah,
which by the way, they'll be out of work soon too.
right. Yep. Especially now, I mean, get your whole business plan off the internet now. You file everything, get it all done, get it created for you, and get your contracts, your NDAs, and your
Yeah.
releases all created off ChatGPT today.
Yeah, there's definitely some good stuff about it. There's a lot of people. I mean, it's funny. There's certain specialties that felt like they're immune, like a surgeon. They got to use their hands and they'll never be affected. But that's not right. I mean, we got robots that will take a gallbladder out and they just program it.
Yeah,
Literally, they will program it. It does the whole thing. And radiologists, oh boy, I feel bad for them because think about this. It's images. You have a computer that will look and interpret, and it is accurate, very accurate at finding things. So nobody's safe. Nobody's safe. So
well, I mean, that's great. You can predict that because that's something technology can predict. You can scan millions and millions and millions of CAT scans or
yeah,
images or MRIs and start creating patterns off that. So
the,
that's
the data's there. Yeah, absolutely. So that's why create your own image because that's the only thing they can't take away from you
that's
is
right.
your image.
Speaking back to your brands,
Yeah.
one of the cool things was about your brand. I was driving uh, down the road the other day. Is your radio commercials? They're very unique. I was sitting there listening to it. I was like, man, that sounds like the Dos Equis commercial. And I'm like,
Yeah.
no, that's George. I know him.
Yeah. I actually paid a guy that was a voice impressionist who did the guy at the end. And I just thought it was funny because, part of the brand is first of all, I don't take myself seriously. I don't, but it's funny to come across as, I'm the smartest doctor in the world. And yeah, that's obviously what that commercial was. I think it said at the end, stay excellent, my friend, like me.
Yep,
And I got so many people laughing that came in just wanting to see the place because of that stupid commercial. Oh, well, actually, it's not stupid. They're just bringing people in, so I love it.
that's right. It did its work. Yep. And then you did the faster than the speed bullet one, I think, as well too. Recently, I heard that one on there.
Oh, Aqua Vitae does not endorse the irresponsible use of alcohol, but they
Yeah.
get
Yep.
it. So, yeah, it's got to be. I have a great firm that allow me to push the edge on those things because a lot of people would be afraid to put that kind of stuff in their commercial for, again, because they're afraid somebody's going to get sued. Like I said, we're not advocating it. We just
Right.
edit,
Yep.
you know?
Yeah. That's great. And it's part of the brand and the vibe, and you get that feel when you go into the IV bar.
Yeah, absolutely.
So one of the things I always like to talk about on here, and this is in the healthcare realm, in your business world as well. If you could solve any of the issues like we talked about today in the Panhandle, what would be one of the biggest things that you'd like to see get accomplished or resolved just for the Panhandle here in Florida?
That's a big question. Is there any, can we focus it down? Is there a specific?
You got to chat GPT it. You got to get it and get the bullet points. No, let's focus. Let's do it on two topics. Let's say for a small business, as you we'll start with that one, and then topic
Okay.
two would be in the healthcare industry of how we would improve doctor retention, nurses, or better healthcare in the area. So
All right, I think I can answer those. For small business, I think they need younger blood, on the city council. I think they need to be more open-minded. There's a place in Alabama, what's not Alabama, we screwed up. Where they hold the volleyball tournaments. What's it called? You know what I'm talking about.
yeah,
No, no, it's right. It's by the water. It starts with a D or something. I can't. It's not Duluth, but golly, I can't think. But
Dothan?
anyways,
Dothan?
okay. Is it?
Dothan.
Is it Dothan?
Maybe.
Well, they don't have beautiful water like we do, and it's Alabama, and they're killing Destin by tourism. They hold the national volleyball championships for girls there, which was ingenious. Now they're going to hold the national softball championships. They have an amusement park. Is this helping?
Yeah, yeah. I think it's. I'm trying to think.
Foley,
Orange Beach. Yeah,
Foley, Foley. Yes. And they are booming. And they do not have anything near half as pretty as I think that we do here. If you look here, I think there was a news story. There was a woman trying to get a food vendor or a truck license for years. You've driven around, you don't see
yeah,
food trucks. That's intentional. And so that's because I think the city council here is resistant to change, and that it keeps young people from coming in. I guess they're scared they don't want us to turn into Panama City. But even Panama City, recently got the new Dolly World Pirate Show or whatever. They've got Top Golf. Why are we not getting that kind of stuff here? We would make it, this town would do great. So that's one. I think they need to be more open-minded to allowing new businesses to come into town. That would certainly help the economy. Because you've been here. I mean, well, the beach
yeah.
thing is it. So it just seems like it's one thing after the other.
Yeah, I mean, we build houses and take down forests and overdevelop, but we just finally started getting chain restaurants down through the 38 area in Santa Rosa Beach. Because before, the only one that was
Yeah.
there was at Hardee's because it was grandfathered in a loophole, but nothing else is down this way. But
No,
we
it's
can
going away because
overdevelop it. We can put 100 houses or 1,000 houses out here, but we can't put anything that brings business or economics to
yeah.
the area. So I
I
agree.
mean, I guarantee if you put a White Castle here, those people would be a billionaire.
Yeah,
Um, you know,
put it right beside your IV bar. Be a great idea.
oh my gosh, I'd be the number one customer. So that would be number one. The other you said was regarding
So improve
healthcare.
healthcare, yeah. So what would be better to get more doctors, nurses, PAs, or professionals into the area that would stay in the area?
I think it's going to have to come away from the top. I think, I love Ron DeSantis, I really do, but it's going to have to come from him down. So that means people are going to have to write their city councilman and do it the way you should when you want try to change things, get the laws changed. Don't make it so easy to sue great doctors that won't come here because of fear of frivolous lawsuits. So that's a big one. Also feel that this is a big one. Corporate medicine is just not a good thing. And here I work for a big corporate.
Right.
They're a good company for what they are, but uh, you should not be able to tell doctors what to do. I'll leave it at that. And that's written. There's laws that state even to own a hospital or a clinic, 51% of it has to be owned by physicians. And it seems like there's been a lot of loopholes that have been taken to circumvent that. And when you control independent thinkers, they're not going to want to come here. So that's got to change. It's going to have to come from the top. I think Florida's a great place to live. Obviously, I love it here. It's been my favorite place of all time. But I will say it has probably been the most stressful as far as being a doctor. And I've worked in some bad places. I worked in Las Vegas, right off the strip, and I worked in Albuquerque, New Mexico on Martin Luther King Drive, which was a very dangerous place.
Yeah.
And it was not because of the address. It was just a very dangerous place. And they made it fun to work there. So you already have a stressful environment. Why make it more stressful than it needs to be? So
Right.
I think that's a big thing. And then the third is, which it looks like it's come to a halt. The whole nurse mid-level try to gain the rights and privileges of somebody who went through medical school. That was becoming a problem, and that also, I don't know if you're aware. I think it was last year, or the year before, for the very first time, they had less medical school applicants than they ever had before. That's scary. That tells you
Yeah.
something that people are not looking at. Well, think about why would you want to go to medical school? It's 8 years of that, then another 3 to 6 years or 7 years, depending on what your specialty is.
Right.
You have such an incredible debt, but when you can just go to nursing school and come out and say, take an online class. And I know it sounds derogatory. Again, there's good NPs and there's those that did the online school. And they're awful. They're awful, and they don't have any debt, so they want the same pay as that person that went and sacrificed 15 years of their life after high school. So that's a big thing too. So
Yeah.
once all those change, and then this will be a great place. And I think it's going to happen. Doug, you remember the old commercial? It used to be in magazines. We always go back to the basics.
Yep.
It was a really good advertisement. And I think you'll see that. And you're kind of seeing it with concierge medicine. There's been doctors that are opening up 100% entirely ran doctor hospitals, no MBAs,
Yeah.
just pure doctors, and they're doing well.
Yeah.
And in fact, if you Google the U.S. Times, there's a great article that you might find fascinating. It came out a couple weeks ago. It tells you everything you need to know about what's going on.
Yeah, that'd be good. Yeah, for listeners today, and myself would definitely be looking into that. But no, those are great insights, and sounds like they can be fixed relatively easy based on electing the right officials. Correct?
Absolutely. And if it doesn't, I can come live with you, right? If in case
Yeah.
I do
Yeah.
my job.
It'll work out perfect. I'm not a doctor, but we'll have Wi-Fi, so you'll be good to go.
There you go.
So no, George, I appreciate the time today.
Yeah.
Before we end, I know you're launching your own podcast here coming up. If you haven't already launched a few episodes of that, how do we get to your website? And I'm sure you're all over social media to
Yeah.
get the IV bar.
So my IV bar, we have a website. It's Aqua Vitae, and that's AQUAVITAE